Nick, appreciate coming back on the podcast as well. So we originally had you, so it was number 25 on October 2020, and we were having a little bit of preamble already on this, and we were talking then around Search Factory and that was a prolonged sale actually. There was a sale that happened in 2016,
Yep.
I think, and it was sort of like all the way up to 2019.
Yep.
So we had a bit of a chat around scaling up companies, success, from trying to be an entrepreneur, having to go back to the workforce, going back. And we find ourselves in 2022 now with another company, with Midnight Health. So there's a few things that have changed obviously since that conversation, but we touched on it a little bit earlier. We were talking just before. There's also been a big change in your life, and that's growing the family. So you've got a new addition to the family, a little one. I think you were saying 9 months now.
Yep.
What it's been probably more than 9 months that really has changed your life. So, besides, and we'll get into Midnight Health, what's the biggest way for your day-to-day life that's changed in the way that you behave or react?
It is really different, when you have your first child, the first couple of weeks, when we're actually going through raising our second capital raise as well. So had a baby, first couple of weeks, you're not sleeping. I'm like, how do I even do life and have a baby at the same time? Yeah. And eventually after that starts to settle down a little bit, but it's definitely changes your routine as well. So, for example, partly due to getting busier with work, but I used to go to the gym at lunchtimes every day, whereas now I go at 5:45 a.m. because that's the only time that kind of works with having a baby and wanting to get home and help my wife when I can, after I've been at work all day. She's been with the baby all day. So, it definitely changes your daily routine, and then it changes it when you get to the weekends as well. All of a sudden, we've been together for a long period of time. We've decided to have kids at this stage of our life where it's we've had many years where it's only us to think about. And so, now I'll try to spend time, on the weekends, allowing my wife to go out or do things that she wants to do, whereas I only had to think about myself or her, when we get to a Saturday or a Sunday previously. So fortunately, my mum is really good with looking after our child, so she lets us go out on weekends and do things like that. So we probably don't feel like we're missing out on as much as other people do because we've got that good support there. But yeah, it definitely changes your whole life routine, I suppose.
And so changing what your life was going to be before the baby was born. So you find yourself slightly changing, the workouts in the mornings and a few different things even before that little baby came?
No, I don't think so. I think I guess different parents probably approach it differently, but we were kind of we wanted to create a life where she also fit in with us at the same time as well. And that's easier said than done, right? But we also want to, we drag her around everywhere. Now at a young age, we make sure she's not a baby that is sitting at home all the time or has a super strict routine that we have to stick to and we don't do anything because of that. Because we're for us to grow as a family, we want to be able to drag her around with us and enjoy doing things with us and all the rest of it. So we've tried to, even in this early stage, maintain as much of that. Get up on the weekends and drag her out. I've taken her out to car meets with me on a Saturday morning and do all sorts of things. She doesn't know what's going on, but get her started early. So we didn't change too much of our routine prior. I think we've kind of we just go with the flow people as well. So I think that's the thing. We haven't come into it with a rigid structure of this is how we're going to be parents or this is our routine. We go, let's work out together what works for us and keeps us happy, keeps the baby happy, and we'll keep going from there. So I didn't plan to have to get up and train at 5:45 in the morning before it happened, but it's worked out. I'm that's the only time I can fit it in, so we just make it work. So yeah.
Personally, I'm starting to go down the path because we're also expecting in April next year, and I'm an early gym person. I'm thinking, do I have to start shifting it before it actually, the baby comes, or a little bit afterwards? So that's sort of that question as well. So obviously that's the first, addition to the family. New baby since the last time we had a chat. So there's also a new baby now, Midnight Health, and all sorts of subsequent companies that sort of stem from that as well. Where did that idea come from? Why healthcare? Why that space? What was the first sort of seed of the idea of this sounds like a possibility?
Yeah, so the thing that I like to do, and I've kind of done for many years, is always look to other markets outside of Australia in terms of what's getting traction. And pre-COVID, I'd go over to TechCrunch Disrupt every year in San Francisco and just have my mind blown by the startups that people are working on there in the center of Silicon Valley, and I just love the energy that exists there. But then you also find that ultimately, things that are gaining traction in the US or even the UK and other markets, usually end up here 3 to 5 years later. So I've seen that as a pretty consistent trend over my career at least. And so I started to have a look at, when I'd finished, was coming towards the end of the earn out for Search Factory, I was having a look at different markets, and there was a few companies like Row and Hims and Hers that were kind of getting a lot of traction in the US market. And so from my perspective, it's like, well, that's going to make its way to Australia at some point. And then you look at the healthcare industry and you go, it's one of the last industries to actually go through this like technology adoption and improved user experience process like almost everything else around us has. And there's many reasons for that. It's super challenging. It's a tough industry to do it in, but it's going to get there. Like it won't stay the way that it is now. And so part of, so there was a couple of prerequisites. I was like, well, this is a really big opportunity. It's it's an opportunity to work in a space that you actually have a big impact and improve upon people's lives. It's a business with purpose, and I felt that through my career, starting an agency, and other businesses that have done all right for themselves, there still hasn't really been what I would consider a real purpose to the business, And so I think someone coined it to me a while ago of having a business that's like profit with purpose, which I think ultimately is a great way to look at it. And so, and then I said, well, how can I do something that's even bigger as well and more impactful than the last businesses? And so then kind of stumbled on all of these things aligning to go digital health and is the space to be in, or the space where I want to be in, and tackle this like next challenge. And that's kind of where we, as I said, we're building out the model for the business, and then going, this all looks good. And then we went into the first lockdown for COVID, and then said the stars have aligned. This is the time to start a digital healthcare company in Australia, and so here we are.
So I guess for the Australian market, it's probably still in the face of. So I was trying to explain this company and the concept to a couple of people before we had this conversation. So my partner and a few others, and I'm sort of explaining, sort of. Pharmacies, it's sort of a digital way, it's potential products that it's quite simple, straightforward, you might be doing it on a weekly or a frequent basis, that you're not having to go to a personal thing. But what I found was it almost seemed like the mentality was still in I'm going to go see someone, I'm going to go to the location rather than maybe the digital. And I kind of went, I'm not sure right now where the digital wave is in the Australian market, in the healthcare. Yeah. When you view it, are you seeing the wave coming towards you that you're about to start surfing? Is it, in your view, you're kind of surfing it is here now, or it's just trying to jump on now as the wave continues? Where is it at the moment?
It's still in the early adopter phase, I think. We've had over 40,000 customers through our platform. There are people who are early adopters, typically the younger audience who don't want to have to go to the GP and sit in the waiting room, don't want to have to go to the pharmacy. The same generation of people who most likely also pay for Uber Eats to deliver to their door because they don't want to drive out of the house to have to get it. It's easier to pay $6. So I think that there's a wave of people who are adopting digital health now, but has a long way to go. And that's also one of the reasons why this business is exciting and interested and attracted me, because we can be one of the earlier movers in this space to go, how do we actually create an entirely new customer experience when it comes to accessing healthcare? Yeah. And so that's exciting, but that also comes with a whole bunch of work and education and creating demand and getting people to actually be aware that you can access healthcare that way. And it also, there's where we're at right now as a business in terms of having probably around 20 conditions that we do telehealth scripts and medication delivery for. Our longer term vision is in building like a complete healthcare ecosystem that's accessed digital first, but also allows you to move seamlessly between the online and offline environment as needed. Yeah. And so we've got this wildly ambitious roadmap that's so far from where we're even at now. And I think that's ultimately where healthcare will head, and that's where it is heading in a direction in other markets, but that's probably like a 5 to 10 year runway, right? Before people that becomes their daily routine.
One of the interesting things we're finding even with the podcast, right? So a year and a bit ago, we transitioned to being completely funded through Bitcoin. So it's like sort of transactions through Bitcoin. So people who are listening to the podcast, there's other platforms which allow people to. It's kind of like Patreon or those sort of avenues. You can send these streams through Satoshis and through cryptocurrency, and so we've pushed hard that way. One of the things we find though is we're kind of half teaching individuals to be able to do that, to then also onboard them. And again, it's one of the things we see elsewhere that's sort of coming, but not just yet. And it's sort of that like learning and teaching people. So for people, we're talking about our mental health. How do you explain to not so much say investors and the potential of this ecosystem, but to a younger generation coming up, and why would they utilize some of the products? How would you describe to them in a very simple way, hey, this is what Midnight Health and the subsidiaries here of the companies are, and this is why you would probably choose this option?
Yeah, so I think for us, it's two things. I mean, one is distilling it down to an easy to understand process. So our website is it's 3 steps. Select the condition that you're looking for, fill out a questionnaire, pay $25 for a doctor's consult. Then step 2 is that the doctor will review, have a text-based message with you through our platform if necessary, and then issue your treatment plan, come back to pay for your medication, and it's delivered. So again, we try to distill it down to a pretty simple, easy to understand process. So I think that's the first thing. But the other thing is that I also think that healthcare as an industry looks inwards to what a customer experience should be, whereas we're trying to look outwards and go, well, there's so many businesses that have invested millions and millions of dollars and countless hours to create great customer experiences that we all use in our everyday life. That's what our healthcare experience at some point should mimic. So while there may have to be a whole lot of complex things that happen in the background, your user experience doesn't have to be that. And I think most user experiences in healthcare are built for clinicians, not for the patients. And so that's where we have a really great opportunity to change that. And as soon as you start to mimic experiences that we're used to through other platforms that we use, that also makes it way easier for customers to adopt. And so I think that's the other thing too. If you know how you use Netflix and Spotify and Amazon and a sports betting account or something, it's they don't come with instructionals anymore. You pick it up, you know how to use it. And so we go, how do we create that so that the jumping into our service is much easier than it might be if you had no idea that digital healthcare existed.
And because you've got a deep expertise in marketing, where are you finding in sort of being able to market this to the broader community? Okay, at the moment, is it Australia based or is it broader than Australia?
All Australia.
All Australia. So across Australia, how's our marketing look in the differences between the existing sort of way that this would be done through pharmacies and the like to how you guys are approaching it? Is there a particular strategy that you guys are finding, okay, in this way we're going to go digital, almost digital first? What's the shift in the marketing strategy or the thoughts behind that?
Yeah, I think that's a key call out, because I think that's been highly valuable for us getting traction, getting investors on board. Being able to actually market a business is critical, right, to getting success. What's really great about what we can do in a digital environment is create, a couple of different niche brands that speak to very specific audiences. We have Yuli in women's healthcare, Stagger in men's healthcare, for example, that speak to audiences through content, through social media, in ways that generic clinics or pharmacies can't. A chemist warehouse or a big pharmacy or doctor group, have to ultimately have a pretty generic brand positioning. They can't speak to niche audiences very well. So what we can do is create personalities through those brands, engage with people who are like-minded and speak to those audiences, and build a digital-first marketing strategy that also acquires people that are looking for the services that we're providing or more likely to adopt those. Digital marketing plays a huge part in how we acquire customers now. A lot of people through Google search are looking to treat certain conditions already, but then we also get a lot through paid social, for example, through Facebook and Instagram and those types of channels, where we can be very specific about the people that we're targeting who fit within the personas that ultimately are more likely to use our services.
Yeah. Look, if you haven't seen Facebook listens to this and you actually haven't seen any of the posts that most of these companies are say, you mentioned one, Yuli. I find myself now, again, you're talking 2-3 years ago, I wouldn't even imagine that these sort of things you'd be sharing with people. You might just tell a friend off to the side. I found myself sharing, hey, this is a cool product, and the way that's being presented is, at the very least, more of a consumable. You want to interact, and it does feel more personified than it feels like, it's, as you say, the clinician or somebody else actually putting that together, and I'm just the end product. I'm just the product, basically, where you're kind of putting the customer at the center of it all and making the ecosystem work predominantly for them, as opposed to that. Over the last 2 years, so from October to end of 2022 now, where has been the biggest challenge in the growth currently of, I'm going to talk about the parents of Midnight Health overlooking all this. What's been the most challenging or the key piece that has been we need to really focus in on here to enable everything else to really fall sort of the leading domino? What would that look like for you?
There's 2 things that have probably been the most challenging part of the journey. The first one is raising capital, which ultimately at the end of the day we needed to do to be able to try and deliver our vision. And so I naively thought that would be a simpler or easier process. I exited my last business, had a little bit of a track record. You obviously, read daily news reports of all of these startups who are raising millions and millions of dollars of capital. And so I thought, surely, I already had a bit of a network of people I could start with. And so I thought, surely this would be a somewhat easy-ish process. And then after going through that and pitching hundreds of people and having, same amount of no's almost for this reason or that reason, or not fitting people's mandates and all the rest of it, it's you go through a pretty tough process, to raise capital. And so that was the first thing. That was easily the hardest part of, probably to date, still one of the hardest parts of this business so far has been that. But then it comes down to, it's just a numbers game, right? So it comes down to finding the right people. And we ultimately ended up, we've closed 2 rounds now with NIB, the health insurer, and that came from our businesses being perfectly aligned of like what we were trying to deliver and what they wanted to be delivering as well. So it's just a numbers game of finding the right people and right investors who match with your business. So
can you talk a little bit more about that, obviously without any details that you need, but where because I've often talked to other people where they talk about, okay, I don't want to get funding from this particular VC side because I know I'm going to be hammered to reach certain numbers and certain status, whether you go private, you try to do it all yourself. Why? So NIB obviously aligned in that way. Was it anything in your mind of, okay, even before that, this is sort of the individual or the group or the entity I want for funding because X? Like, what was that reason of to not go for, say, a different model?
Yeah, so one of the most important things for me, and it wasn't necessarily targeted at NIB, but what was very important for me was let's find a strategic partner to invest in earlier rounds. At the end of the day, when you're a startup, capital can come from wherever, and sometimes you take whatever capital you can get, right? But for us, it was like, well, how do we find a partner who can come on board with us, who we make strategic sense to them, they'll be in it for the long haul. It's not just money in and money back out, and we've seen, and fortunately, we've seen that this shift that's happened in the VC markets over the last 6 or so months is we have all these struggles in the economy, and all of a sudden this growth at all costs VC mentality changed within a couple of months, and all the startups who'd been funded by those same people are told, now you need to try and be profitable as soon as possible, and they're shedding 20-30% of staff on a weekly basis from all these different startups. Whereas we're at the point where we've got someone who's with us for the long haul, who's been through numerous market downturns, who actually view the current situation as how do we build and grow and go harder and faster while everyone else is retracting, because they've got a strategic investment into this and they're looking at it for the long haul. And so one thing for me is that I didn't want to end up with a cap table through the first round that had 12 different small VC funds or angel investors who couldn't back us through a next round, who then also made our cap table messy, brought a lot of opinions to the table. I still think there's certainly value from all sides. There's the strategic investors, but then there's also high growth VCs with a lot of experience who I would also like to be on our cap table at some point. But I think if you have the luxury of finding investors that can bring more than money to the table, then that's ultimately what I think is the best outcome for a startup.
Yeah, and a very powerful thing to have, obviously. More than just that, and be able to have a long-term deal, like a long-term game that you're playing, as opposed to the short-term transactional thing that, as markets go up and down, might be like, okay, cool, you need a pool, or you need to do something to be able to meet that particular demand.
Yeah. The other thing I'll just add to that, though, however, is that I think that I've also seen other startup founders who go, I really want to get investment from this one company, and then they put all their efforts into that and waste time, energy, where they could be pitching and finding lots of other potential investors only for that investor not to give them money. Yeah. So your best case scenario is you pitch everybody that you possibly can, and then get a whole bunch of options on the table and then go, who do I want to invest? That's your best case outcome. As opposed to try and decide first who you want to invest and then only target them.
I feel like that might be fraught with danger of the expectation and not being met, as opposed to the availability and then going with those choices. I think Search Factory, we talked about last time, had, correct me if I'm wrong, was it around 10, 15 employees?
When we finished up, it was about 32.
32, okay. Yeah. So now we're looking at Midnight Health, and I think it's bigger than that. It's actually over 40 individuals at least.
Yeah, we're almost at 50 now.
Almost 50 now. Once again, in this growth or scale of bringing in people, did you find yourself taking a lot of those learnings that you had in the initial of, okay, cool, this is now the priority in terms of either the hiring or the way we hire, the people we're looking to hire, the long view that we're doing, equity versus salary, and people trying to stay within sort of a one company and not moving around. What are those learnings you took from Search Factory and the growth there that you've applied and gone, okay, this is, I can see now this really worked much better in our operations now.
Yeah, I definitely learned a lot of lessons through the 9 years of the Search Factory journey. I made so many mistakes with hiring, so many mistakes with the team structures and all the rest of it, which has definitely played a role in getting us up to speed more quickly and being able to, in reality, we had 8 staff in January this year, and we've now grown from 8 to 50 because that first 12 months of the business was obviously pre-capital raise and all the rest of it. So we've really grown most of the staff in like this year, and so the most important thing that I learned through Search Factory period is to hire the right people, and I mean, fortunately, again, as a funded business, you can have the capital to do that, and that was important for me because say when you're bootstrapping a business. Through Search Factory days, for example, you're not always hiring the best person because sometimes you're hiring someone who's cheaper or who can start earlier because there's a rush to find someone because you're waiting to the last minute. So for me, the most important thing is trying to spend the time to hire the right people. Like some of the roles we have in here now, I interviewed 30 people for and just kept going, no, not quite right. I want to make sure they get the exact right person. And so that's the most important lesson. Like if you pay 20 or 30 grand a year more for someone, but they are the right person for the role, that pays itself back significantly more than the 20 or 30 grand you saved on someone else, right? So that's really important. The other thing is, trying to make sure that we find people who fit the culture well. Spend a lot of time on speaking to people about what they're looking for in the business, what sort of culture they're looking for, trying to find people who are the right fit. We've found some people who are technically great, but have great experience behind them, work for great companies, could probably come in and add a lot of value, but then don't fit with the culture. And so that's something that we try not to compromise on as well. And so I feel like we've gone through this period because, you can go from 10 to 20 people or 10 to 30 people and start to lose some of the things that make a business great. It's easy in that small startup phase to have a really small group of aligned people who build a great culture. But, we've done a pretty good job, I'd like to think, so far in getting to like 50 people and maintaining the culture, or a large part of it that we had at 15 people. If anything, try to make it even better. So I think that's really important as well. And that was important for us post-pandemic because there's a lot of people who just want to work hybrid, right? Want to work from home. So now we've also got this dynamic of people who want to work remote 100% of the time. And so especially the software engineers, for example. So we've had to go through and find great candidates who I want to come into the office once a month. So actually we come in 2 to 3 days a week, a couple of days from home. We're trying to build a culture. We're trying to collaborate with people. You can't do that if everyone's sitting at home on Zoom. So there's different principles like that we have stuck to in the business, and I think that's paid dividends for us as well.
It's a big challenge. I mean, I've personally seen it in the contracting space. The overall individuals just choosing not to work anymore because there's another offer in terms of, I can work from home, I can go into the office once a month. I get what you're saying with the culture, where for me, I currently go into an office 2 to 3 times a week, and I really enjoy that. I do enjoy that interaction. One thing I find in some of the current gigs that I do, though, is that from a culture perspective, it's largely a team based, as in within a team they'll build it, and as it's growing bigger, there's no top-down culture where it's kind of thinking of you talk about culture, what percentage for you, in your day-to-day thinking, do you think in place of, okay, it's important that even you yourself are contributing or are helping out or are putting some sort of effort or allocation of time on, okay, we need to put this effort so that we continue this, maybe once a month or once a quarter for retreats or week, daily sessions, or similar. I think that Health does do that. Would you say it's still a big component in your mind right now, or have you found that the teams perhaps have already sort of started building that up in their own culture that was built from 6-9 months ago?
Yeah, look, I think there's 2 aspects to that. I think one, you want to create a company culture. So we're trying to make sure that we have rituals like Friday weekly team meetings. Every quarter we do what we call the midnight muster, which is where we all go out, do some kind of activity. We had our Christmas party on Friday night, a few sore heads on Saturday, and we try to create once a month. One of the team has taken upon himself to host a barbecue with the team as well. Which everyone likes. We supply everything for that. Everyone just gets together, has a drink, have a barbecue. So I think it's important to have like whole company rituals that bring everyone together. But then I also think it's important to allow the staff to engage within the business and create that culture. As I said, Luke decided that we should buy a barbecue because we've got a deck up the top in our office. So I don't know if he wanted to host it every month, but he's kind of just ended up becoming the resident barbecue cooker. But that's great. I think if you've got if it's not forced by me that everyone hangs out together and engages in these things, but it's actually the team that's facilitating and creating that themselves, and that means we've built the right place and a good workplace. The only thing that I'll say is that I think that you want even the individual or team-based culture or activities to flow out to the rest of the business as much as possible, because you don't want to get to a point as you grow where you have siloed cultures that are different, within different teams. I think the more you can take the whole company on that journey, the better.
Yeah. And what's your expected growth in terms of the company? Do you see it staying at that 50, 60, 70 sort of like two figures, or are you thinking, okay, as this goes and everything going really well, it's going to go 3 figures plus? Like what, from your mental perspective on that, do you think it's going to be double, triple in growth?
Yeah, so we're just going through planning at the moment for our next capital raise. So we're certainly not looking to slow down anytime soon. We'll probably add another 30 or so people next year, bring us up to around 80 or so. I think that'll be a good number for us to then just put everyone to work as a team at 80, and we should be able to deliver a lot of things at least and get the growth that we need to support kind of the next round of hiring. But I certainly see over the next couple of years probably getting to that 100 plus company size. So right now I'm working out where's our next office, because that we might need to move into next year.
And again, that'll have the, because now you're talking team of teams sort of thing, and then you have those different levels that start moving towards, okay, you can't have a centralized view of a lot of things, everything's going to be decentralized in a way. So now I want to pick on, you mentioned the Midnight Muster.
Yes.
I thought Muster, and I thought Jocko Willing, and I thought Brazilian Jiu-Jitsu. It's something that you do as well. I want to see how long have you been doing BJJ now for, and how much of, I guess, the discipline or the benefits that come from that have you seen extract out to various areas of life? Because myself, I hear it. I hear a lot of people talking about it. I'm not putting my foot into it. I go, maybe I've got weak knees or something else. So from your perspective, how long and what are the benefits, probably physical and mentally, you see across broadly in life?
Yeah, look, I mean, I think I started like 13 or 14 years ago now. So I've had a couple of breaks in between, as you do, but I'm training pretty consistently again now. So it's definitely played a large part of my life. Like I've been through my jiu-jitsu journey alongside all my business journeys and failed startups and all the rest of it, right? And I think it teaches you a lot of different things, right? There's a persistence that comes with jiu-jitsu. Like, you get injured, you turn up to training on days when you're not feeling good and you don't want to be there. And when you start like early in your jiu-jitsu career, I guess, you find that those types of moments actually like drag you down. You turn up to the gym and you're not feeling good, and then everyone's smashing you, and you're like, you leave on probably feeling worse than when you got there, right? But what you learn over time and by showing up every week and training hard is that you don't win all the time, right? And you actually need to be able to turn up and take those days where you're not feeling good. But you know what? You might turn up next week and you'll be feeling awesome, and you're feeling fit and you're feeling healthy, and all the rest of it. And so I think that there's the mind game of jiu-jitsu that it's hard to understand if you don't train, but it is just that, that consistency and being able to stick at something and and spend time and refining an art, I guess, or being or going through something where there's like a never-ending learning phase. And it's very similar to business, right? Like, I've now been training jiu-jitsu for that long. I'm a black belt. I feel like I almost know less now than I did 4 years ago, because the game keeps evolving, and it's just that constant process of learning and adapting and understanding new ideas. And it's the same when you're in business or even in life, right? Like, you have your ups and downs, you have the different challenges that come along the way. I look at becoming good at a sport or anything like that is the same as becoming good at business. It's like you put the hours in, you learn things along the way, you refine your the way that you approach stuff, and it all comes with education and learning, and you just get better and better as you keep doing it. And so I think there's a lot of things like that, and I think you also get taught to be humble at jiu-jitsu as well. Like, I think for kids to go and
forced humbleness.
Some of the dudes that rock up at the gym who if you saw in the street, you would you walk past them, you wouldn't think anything of them, who are absolute beasts on the mat, who are like so good at it. Like it teaches you to respect everybody, to be humble, like to, I think there's a lot of people who could learn a lesson from that in itself.
Yeah, absolutely. I mean, as you say, taking it into business in general, it's kind of nice to be, as much as, what sort of size it could be, being humble in the sense of, okay, there's a lot of foundational things that you kind of forget it as you grow, as you can become bigger, you can kind of just go, I'm just taking advantage of it, and then all falls apart. You mentioned, down the path of kind of like the more you know, you figure out it's like the less you know. You kind of go, okay, there's more things here in the horizon. I felt that way in many a thing. One thing, interestingly, has been cybersecurity in my eyes, because it was something that, it was around 2017, 2018, was kind of talked about in the consulting strategy world, not really being put into that much of an effort or value, but specifically in the healthcare space. I think me personally, I was a AHM customer, and so unfortunately I got all my deeds drifted off into the dark web. I've started to see all the messages come through around that. That event, or even previous to that, has cybersecurity for Midnight Health in general been top of mind? Their presence as part of the company, or shifted the landscape when it comes to data and the way that people interact with that data?
Yeah, look, I think that one of the things for us is, cybersecurity is always important, but when you're a small startup and you're getting to market, it's like, you need to put a lot of resources into cybersecurity. So you go, it's always it's a never evolving process. It's kind of, it's something that never ends, right? Cybersecurity doesn't end. You're always working on it, right? And so one of the things that's actually been really good with us about, NIB has an awesome cybersecurity team, and when they made their first investment in us, part of their due diligence was to do a big cybersecurity review, and so we got their team did for us what we probably would have paid a consulting firm like $200,000 to do the same thing. They said, cool, here's a roadmap, here's what we need to do to uplift everything. So we went through a cybersecurity review. Then we went through, first thing we did when we took on our first capital raise is invest a whole heap in our own resources plus external resources to do a big review and uplift to our architecture and improve our cybersecurity. And then that's like a roadmap that never ends, really. Because the thing with cybersecurity is that most companies are always vulnerable. So it's, as we've seen with Optus and Medibank and all the rest of it, who have a lot of resources dedicated to it. So it comes down to how do you minimize the blast radius, if something occurs, and going through this never-ending process of trying to identify any of those possible vulnerabilities and then, and fixing those along the way. So it's certainly, and then when you're a healthcare business, it's even more important. If we're selling t-shirts online, maybe we don't care as much. But when we're a healthcare business, healthcare data is something that we need to make sure that we've invested heavily into protecting and keeping secure for our customers and our patients. And so, we certainly, have dedicated resources to it, pay external companies to do the same thing, and then have the support of NIB and their awesome cybersecurity team as well, so that there's always a very keen eye on what we're doing in this space and continuing to uplift on an ongoing basis.
As you say, with the digital wave going probably through the healthcare space now over the next 3-5 years and beyond, it's that people getting digitally smarter, digitally native in terms of, okay, cool, I now not just realise what I'm giving to you, I also realise that there's this information that I probably don't want, given out to me, and having, again, very specific measures taken in place. I go, okay, cool, I can see and feel that I'm very much protected.
Yeah.
So, in that lens, talking 3-5 years now, whether it's with Midnight Health or, broader in the market or other technologies, what's getting you excited over the next 3 to 5 years? If you look kind of look ahead.
Oh, look, I think that we're at the stage, if I look at digital healthcare, right, I think we're at the stage where, the use of AI in the delivery of healthcare will allow us to move from treating conditions into preventing them at some point, right? Biggest challenge that we have right now is there's no interoperability between different healthcare providers. We have all this data that says if somebody ticks all these boxes, we know they're susceptible to a certain chronic disease or all the rest of it. But the challenge right now is actually capturing all that data in a single place and doing something with it. So, our goal and our vision for our business is, if we're building this access to a whole health ecosystem in a digital environment, we will be at the point where we have clinical and non-clinical data from either using health programs or consulting with the doctor, where we can start to go, hey, we can actually understand your profile and whether you should actually go get tested for a certain disease or whether you should change some of your lifestyle habits because maybe you are showing signs of prediabetes or something like that. So I think that technology has a really good opportunity to make that scalable. And that's the problem that exists right now, is that it's the way that healthcare is delivered is it's not necessarily that scalable. Whereas when you have thousands and thousands of customers coming in to interact, we can actually automate a large chunk of that preventative health. And so that's what I find is really exciting and will have a huge impact on the way that we all look after ourselves and the way that we identify diseases or get tested for things and change our lifestyles. And hopefully that leads to longer lives for people, especially when you look at like regional or remote areas as well, which is something that we super passionate about.
Yeah, I mean, it makes me think of you kind of moving towards the reactive nature of a lot of healthcare. It's sort of when it happens and you're doing something, and kind of moving towards proactive measure. And I like that a lot of insurers and big players are starting to move towards keeping you healthy as opposed to having to then pay out because you're now sick type of level. And I think we can benefit that across Australia and the whole. I can't let you leave without asking you, of course, another car question, because we talked about this previously. We talked about it previously on just before starting the podcast around the new Lamborghini that's coming, the STO. That's in the next year. Now, why? What was the thing around that new Lambo that for you went, yes, that's going to be the one, as opposed to going for something else? Ultimately, was it the engine, the look and feel of it? I had a look of sort of the design that you went, looks pretty rad. I like the look of it. What sort of made the call out for you for, okay, cool, I want to get that one? Yeah,
so I mean, firstly, I loved my last Lamborghini, which I sold a couple of weeks ago, as I said earlier. I feel like it was too early because the new one doesn't arrive till August. But yeah, I did. But look, I loved the last one that I had, and I was even thinking, do I shift to another brand or do I shift to another car? But I was having a look around the market, and I just loved my last Lamborghini, and I want another one. But I wanted something different as well, and the STO. I went and did a track day down at Phillip Island with Lamborghini with the STO, and it's an entirely different car. It feels like, even though it may look similar or have a similar engine to what my last one had, it's entirely different. It's full race spec car with carbon doors and carbon body. It's loud. It's wild, and that's what I like in a car too. I think I've test driven like the Ferraris, F8 and 488s, and that they're a more refined vehicle. But I love the wildness of the STO. So for me, as last NA V10 full track spec Lambo, I'm like, yep, that's what I want to be driving around, because it's just raw and fun and exciting. So are you the type of driver that when you're driving it, it's smile on your face, you're kind of be teetering on the edge of controlling sort of the beast that is the Lambo when you're driving it around, or is it just a very focused but enjoying it all the same? Oh no, I don't drive stupid. I go to the track to do that. But I honestly love getting in the cars, going for a drive. I would drive it to work and with a smile on my face when I jump in the morning, drive through traffic. I genuinely enjoy it. That it brings something to my life that I that makes me happier. So yeah, I definitely love it. And even my last one I had for 3 years before I've just sold it, and I still jump in it every time and love it. And the same with, and I also like a whole range of cars. So I've got a GTIR Pulsar, which is a 91 model four-wheel drive turbo Pulsar. I had one when I was 18, so always loved them ever since. And I bought that a couple of years ago, fully restored the engine and all the rest of it. I jump in that and have a massive smile on my face. My wife thinks I'm an idiot because she just thinks it's a piece of shit. She's like, why do you even like driving this? And I jump in that and have a bigger smile than I have even in the Lambo sometimes. So it's I just enjoy driving. That's something that I love. And so I'll we're moving to a new house soon. The first thing I'm doing is planning the garage build. That's all I care about.
Set it up there. It's a priority in life. Nic, look, I appreciate taking the time. Always having a chat with us at the end of the podcast. What's probably going to be main call out for folks if you want to learn more about Midnight Health or any of the sort of different companies? Where's the main call out? Where can they go and check that out?
Look, you can jump on the midnight.health website. That gives an overview. It's probably due for an update. But follow me on LinkedIn as well. I'm probably always posting things on there that give us an update of what we're doing as business and where we're going. So, and Instagram as well. So, that's the best place to stay up to date.
The Yuli Instagram for sure, because obviously the initial the company that came out, I do love both the imagery and the information that's being presented today. So even for myself, I'm like, it's probably not directly my sort of information that's going to apply for me. I found it to be quite useful to share with other people. So there you have it. So thank you very much, Nic.
Yeah, thanks for having me again. Awesome to catch up.
Cheers. Thank you.